Ideally, we would remove all of those tumors completely and everything would be fine. But there is a price to pay when you do that in every single case. In many tumors,
Welcome to the Mission Brain podcast, where we explore the fascinating world of neurosurgery, uncovering the stories of the people who push the boundaries of what's possible in brain science and surgery. I'm your host, Luca, and today we have the privilege of having a very special guest with us. Joining us from the Mayo Clinic in Jacksonville, Florida, is Dr. João Paulo Almeida. Dr. Almeida is just not a neurosurgeon, he's a pioneer in skull-based surgery, pituitary surgery, and neuro-oncology. With a career marked by dedication to academic neurosurgery, he has authored over 80 peer reviewed papers and contributed significantly to the neurosurgical literature with his extensive research. Originally from Brazil, where he completed his medical degree at the Universidade Federal do Ceará and neurosurgery residency at the University of Campinas, Dr. Almeida brings a wealth of experience and a unique perspective in his field. His journey has taken him from Brazil to Canada and now to the United States, where he continues to make remarkable strides in neurosurgery. I had the privilege of meeting JP at the Mayo Clinic in March. It is here that I truly came to admire not just the professional excellence he embodies in his field, but also the profound humanity that underpins his approach to medicine. Beyond his remarkable clinical skills and academic rigor, it's his compassionate and personable nature that truly resonates with me and attracts him to me. I feel both humbled and honored to be able to call him a friend. Today, we're going to explore Dr. Almeida's journey, his groundbreaking work, and get an insider look into his latest project, the Skull-Based Lab at the Mayo Clinic, a state-of-the-art facility designed to advance the training of neurosurgeons in surgical anatomy. So without further ado, let's welcome Dr. João Paulo Almeida to the Mission Brain podcast. JP, thank you
thank,
for joining us today. It's an honor to have you on the show.
thank you. No, it's an honor for me to be here with you. And as you mentioned, like we met this year, and to me, it's an honor to to be able to call you friend as well, and Alice as well, and Luigi that are part of this beautiful project that you guys have, and especially honor, of course, to be talking with you, and honor as well to be in this lineup because I know the other guests and the other people that you have brought over here are incredible people that truly I consider to be much more meaningful than I am, but it is an honor to be able to share, what we have and the plans for the future as well. So thank you very much for this opportunity.
I can't wait. So let's start with a little bit of context. How did your upbringing in Brazil shape your interest in neurosurgery?
Yeah, that's an interesting story because I'm not one that I was that growing up I was dreaming of being a doctor, and I didn't grow up dreaming of being a neurosurgeon as well, right? I grew up especially during my teenage years, kind of like thinking and playing something with sports, or I practiced a lot of karate, so martial arts, and swimming, running, and all of that. And when time came to go into into college and then higher level degrees, that I was introduced to the idea of medicine really. So I come from a family that is humble, simple family. My mother was a teacher, a third grade teacher, so she was my teacher as I was growing up, and I always saw both of them working a lot, weekends, nights, and everything to the best of their abilities to provide to me and my brother, who currently lives in Canada. He lives in Montreal, and he works for Microsoft, and he has a neuromarketing degree actually. So he's also interested in neurosciences. And I think that that upbringing first brought me the idea of the concept of hard work and the importance of education. So despite whatever challenges that we had, they always worked to provide us with the abilities and the access to the best education possible. And that really shaped my concept of the impact that education has in all of us, and the impact that education has in what we can achieve. So as I was saying, when the time came to med school, the way that was introduced to that in Brazil was that, like, I was a good student, I had good scores, I had good grades, and I was going to apply for something, right? And I was thinking maybe nutrition, maybe sports, or something like that. And then my high school and then my parents, my family came, said, no, you should consider medicine. It's going to be a profession that we're going to provide you tons of opportunities, and likely so a better financial situation for for your life, so you don't have to struggle as we struggle. And honestly, I didn't know much about medicine. I knew there was something good, and I actually was afraid of doctors, I think, and now I'm only afraid of dentists. So that I
As us
refrain.
all. We're all afraid of the dentist.
I'm terrified of this, by the way. And then, I needed a scholarship because at that point my father had lost his job, so we were facing financial challenges. And all of that accumulated with me saying, yeah, okay, I'm going to explore, and I maybe can go into sports medicine if I go into medicine or endocrinology or something like that. And then I did exams, and I got into a pretty good university in Brazil, the Universidade Federal do Ceará. And during the first 2 years, I was planning to actually go to sports medicine. I was going to conferences and journeys, and I really liked the idea. But then I went to the anatomy lab, and the anatomy lab and the anatomy discipline was really what completely changed my interest, and I found passion on that, and even like a bigger passion when I went to neuroanatomy, and that took me to have a chance to interact with neurosurgeons as well, and then to join programs into neurosurgery and neurology. We actually founded a group of study that we call NEON that still exists up to today, 20 years later, in my home school, and then the interest just grew from there. So it was a passion that I found during the journey, or that found me, and then from there things just grew even more.
Well, it's interesting that you mentioned karate and and mentioned your interest prior to entering neurosurgery, because I recall a presentation of yours while I was at the Mayo Clinic about the importance of discipline and mentorship, that are things that martial arts such as karate bring to the forefront. So, as a neurosurgeon, what did you learn about mentorship and the importance of discipline and listening to people that know more than you? And could you shed some light into how young neurosurgeons could approach the idea of mentorship and discipline?
Well, I think that there is, nothing without discipline. So, I mean, if you want to achieve something in life, you're going to have to have commitment and discipline towards, what you really like. And I think to have the energy and the interest to commit that degree of energy and time, you need to be passionate with whatever you're going to choose to do, right? So, if I were not passionate about neurosurgery, and actually very specifically on the thing that I do in neurosurgery, which is skull-based surgery, anatomy and the scopic skull-based, I personally, I don't think that I would do it because it requires just so much of our time and energy that you got to love it, because nothing will pay you back your time away from your family and from the other things you like. So honestly, I have to like it as much as I like, the other things. And I gotta say, sometimes even more than the other aspects of our life. So it's a balance in that regard. But discipline would be the one thing that will guide you to, in my opinion, that has helped me to move from point A to point B to point C. Because things, at least in my journey, they never happen like in a smooth line. They tend to go, and then something happens, and it's a challenge, and then you got to go through that challenge, and then you go again. And without discipline, and I think this sort of like mindfulness understanding of the situations, it will be very difficult. And you don't always have that. So sometimes you go through challenges, so you suffer as things don't go the way that you expect, and then you need to learn. And then as you learn, is that you grow, and then I think you move to the next stage. And for me, martial arts was fantastic. It was exactly what I needed it, because as you know, as you mentioned, I'm from Brazil, and as coming from a Brazilian family, very traditional, which I think somewhat to the Italian families, like we tend to be a bit overprotected sometimes. And like my mother, she is a super mother, and I'm very thankful for that. My father, the same thing. And I was sort of like overprotected initially because I had asthma, and as a kid, like had a bunch of allergies and all of that thing. And then when it came the time for me to go into martial arts, it helped me to overcome a lot of the fears that I had. And it helped me to gain self confidence and to establish a discipline and a routine that otherwise I wouldn't have it. And I was very lucky that the senseis, the mentors that I had, they were always very clear. I mean, you do it if you want to do it. Nobody is forced to do this, but this is the pathway to do it if you want to do it. So the first thing they did, I remember, was like to get my mother out of the training sessions. Said, "This is what you got to do, and if you're not being humbled, you're gonna practice with the sensei at the end of the training, and that's gonna teach you to remain humble." And in karate, for example, one thing that the routines, the katas, they help me a lot to understand the kind of like the pursuit of mastery and perfection, because every movement needs to be perfect, so to say. And then I think you incorporate it's like a philosophy, it's a mindset. So if you do it for that, you can do it in surgery. I think you can do it in music. You can do it in whatever thing that you choose to do for your life. If you're passionate about it, because it is once again, it's a lot of energy. So that helped me. That was my pathway to get that understanding into discipline. And then the pathway to get into mindfulness, I think, came over time and came with, especially so one of my mentors, Fred Gentili from Toronto, that shed light on that and that I like to focus on and think about it as much as I can.
That is really resonates with me because, as we may have talked about this, I was also a really bad asthmatic when I was a kid, and I used to be in and out of hospitals. And I was wondering if, by any chance, the feeling when you were a kid of being frail and having this sort of issues sort of impacted your path through medicine and your the way you view patients and the way you view disease as a whole.
Yeah, I mean, I don't know, like a lot of people that you talk about, and it's normal for us to talk about, like they tend to have this sense that when you're outside the hospital, you're a person, and when you're inside the hospital, you're somebody else. You have a mask and a personality. I think I fail big time on doing that. I don't I think I am so like who I am, and you know that very well. Like, yeah, I don't know how to turn on and turn off. And the only time that that changes is when I'm in surgery, doing surgery. That's when I fully focus, and that's when there is no music, everything is serious, and so on and so forth. But this is just to say that I think every single experience that shapes us, they help us to become who we are. So I don't know if that necessarily brought me to the person who I am when I've been a doctor, when I've been a physician, but I think it helped me certainly so to shape me who I am as a person today. So I believe that I understand fully because, as you said yourself, we all experience at some point in our lives challenges, and that includes health challenges. And so I do have empathy towards people and the challenges that they go through. I like to believe that I can relate well with people and their families on that aspect. I'm, sort of like very hot blooded by my nature, being Brazilian, and we're very social human beings. So I like that interaction. I don't know how to be different. Of course, just like anybody, we do have some separation. So you're not terribly impacted by the relationship, but have a good relationship with our patients that I think are beneficial. So I think if you try to understand, the patient or the family or whoever else you're working with, I think that's much more beneficial to all the sides.
You've mentioned the significant influence of mentors such as Evandro de Oliveira and Fred Gentili. And how have their teachings and approaches impacted your career and your life in general?
If I were to mention every single person that has helped me, like we could go 2 hours talking here because I am thankful for an incredible, huge number of people in all the steps of my journey. Those two names, Dr. Evandro de Oliveira, Dr. Fred Gentili, are people that I especially thank, and I like to highlight their names, especially because they're not with us anymore nowadays. So from all my mentors, those are the two mentors that have had a significant impact, if not the most impact on my life, and that they're not here with us anymore. So Dr. Evandro de Oliveira, he is Brazilian just like me. He is basically, long story short, the best person I ever seen operating ever. And somebody that would do incredible things in a way that it was so incredible that he would be very vocal about it. Don't do it like I do it because you're just not ready to do it like this. This is very risky to do it like this. Like, follow the book and maybe even see somebody else do it, because the way I do it, I don't know if it is for beginners or so to say. But he was somebody that had a tremendous impact on me. And I think in actually a lot of people, especially so people from my country, Brazil, and in Latin America, because Evandro had a very important journey. So he is from Brazil, the south of Brazil, a city called Florianopolis, and he was born and raised at the school there. And then he went to residency in Uruguay, actually, at that point. And then from that time, he was working in his home city for about 7 and 8 years until he met Albert Roton, and he communicated with Roton through letters at that time. So we're like in 1980s here, and he was accepted to go to the lab. Evandro, with his wife and two small kids, two daughters, they goes to Florida, to University of Gainesville in Florida, to Roton's lab that was just beginning at that point. And the story that he used to share is that about a month or so before going to Rotos, he actually received a communication that unfortunately Dr. Roton wouldn't be able to host him anymore. And Evandro had many incredible things and a big personality as well. So what he did is that he went there anyways with his wife and two daughters, and they started a relationship with a big fight, according to Dr. Oliveira, in the office of Dr. Rota. And they was, you cannot do that. I came here with my wife and two daughters. And from that interaction, it became a beautiful friendship, a big collaboration that became, a mastery. So right now, you have the Roton Society that is intrinsically related with the name of Evandro de Oliveira, the big master surgeon that was able to communicate microsurgery with applications in surgery. So he was not only doing beautiful art in dissections or so, he was really translating how to incorporate those in surgery. And nobody else has done as well as he did, in my point of view. And then Evandro, after that period in Rotos, he went back to Brazil. He had a chance to move to São Paulo and to work at the University of São Paulo at the Hospital Beneficência Portuguesa, and then at the university where I did my training. And he really revolutionized the way we do surgery in Brazil, and that was really his effort. So the Brazilian neurosurgery is really super well recognized in the planet, and a lot of it is because of his work. And I'm very, very proud and very honored to have trained under him in residency at Unicamp, and then to have worked with him for 2 years and a half until I moved to Canada. And, he definitely shaped my path in a way that when I first heard, and that's why it's so good for us to get out of home. The first time that I really heard and understood the magnitude of that person in his group was actually in the United States. I had been brought in 2008 as a last year medical student to Johns Hopkins under the guidance of Dr. Alfredo Quinones, Dr. Q, who certainly is one of my mentors as well as Dr. Evandro and Dr. Gentili. And during that time there, I remember a fantastic, mentor of mine as well, Dr. Rafael Tamar, was cerebrovascular at Hopkins. He came to talk with me, a simple medical student, because I had published one paper with Evandro at that time. And then this guy is talking with me because of this other guy. So this must be a real big deal. And then that's when I realized that so close to me in my own country, we had giants of what we were doing, but I didn't recognize because I was just looking to the outside. And then with Evandro, then I met Evandro. I saw all his impact in neurosurgery on a global level. And then I started to reflect and listening to him about the importance of us to value our own work independently of where we are, and to really focus in quality and focus in commitment to work and to commitment to perfection. And his tool to do all of that was through neurosurgical anatomy, and a passion that I shared with him. And so that helped me to share a lot. So independently on where we are, independently on where you are, I think you can do great work. And I certainly think that you shouldn't be thinking anything differently from that based solely on a geographic location or anything like that. So we all can do great work. And I think Evandro showed that pretty well to, the people of my country and the neurosurgeons of my country. So I'm very, very proud of that. And Fred Gentili was, the next guy in line. So when I left Brazil, I left Brazil to specifically become a better surgeon in endoscopic skull-based surgeon. And then I went first to New York City with Ted Schwartz, who is a incredible colleague, mentor, and friend. And from there, I went to University of Toronto with Fred Gentili, and then the rest of the team, including Aguilar Izade, Alan Veskin, John De Almeida, and great
Dream
people,
team.
amazing.
Yeah.
And then Fred Gentili, a master surgeon, somebody that helped to revolutionize skull-based surgery as a field. So he went through basically every stage of the setup, a founder of the skull-based society. He, of course, marked me with his amazing surgical ability, surgical knowledge, understanding of the nuances, but especially so, the one thing that was remarkable is that he was all of that, and he was an extremely humble human being, and he was an extremely social person as well. So he was the one guy that would invite us out to social events to have wine and to go to parties and to go to his place with his wife Gina Gentili. And that just showed me that, yeah, you can be, a master surgeon, and you can certainly be kind of like, you should strive to be a good person. You should strive to have good friends, happy, happy wife, happy life concept, and to live. So Fred Gentili, he was a Italian Canadian neurosurgeon. He moved from Italy at age of 4 to Toronto from humble beginnings, but extremely dedicated human being, very bright, proud Canadian as well, and Italian. He would go to Italy every month of July and spend the entire month there in his hometown in Italy. So a very Italian style guy that was very, very proud of all his work. And he was a masterpiece at the University of Toronto, at the Toronto Western Hospital. He, at age 60, when a lot of people were criticizing endoscopic, he got into the field of endoscopic. So he moved exactly against the wave. And then he joined the new wave, and he became an exponent name into endoscopic skull base surgery. But once again, with him, I think that the most important lesson was not only the technical aspect, but this aspect. And he had many challenges in life. He himself lost 2 wives to breast cancer, not one, two. I was challenging for him, I'm sure, to raise his kids, but he did the best he could, and he had support of family and friends. He had Gina Gentili, his wife, as he approached the last stage of his life, and he learned mindfulness. He learned the importance of understanding meditation, mind control to succeed in life, and I try to learn from that because I know that was very positive to him, and I think can be very positive to all of us. So those two giants, as I mentioned, Evandro had lateral sclerosis, and that took his life 2 years ago. And Dr. Gentili himself had a brain tumor. He had a glioblastoma, and he passed away in early 2022. And unfortunately, I lost those two mentors, during the COVID years, so to say. So that was difficult. But that's the special reason why I mentioned them so much. Of course, I have amazing words to share about great people. For example, Dr. Kiro, he was the first one to brought me here to the United States. Without him, I wouldn't be where I am at all. And he helped me to shape a lot of this social interaction as well. I tried to almost to follow his style in terms of interaction with families and so. And I think that if my patients like me so much as his patients like him, I'm gonna be pretty well. So I think in life you have to learn from everybody that finds your way, and I try to do so.
Beautiful. So, what inspired you to specialize precisely into skull based surgery? And what inspires you still about skull based surgery that you think is something very specific about your field and still makes it beautiful after so many years of practicing?
Yeah. Well, number one is this, I have to say, is the challenge. I think the challenge, and it's a challenge that really requires, we work in a multidisciplinary environment, that is for sure right now. So it's not a single man type of show or anything like that, but it's still one that requires a lot of individual dedication from the part of the neurosurgeon. So you need to be prepared. It's like if you're an athlete, you need to be prepared with your knowledge of surgical anatomy. You need to have, your mind prepared to the challenges, and you need to be mindful in terms of selecting how you're going to manage each one of the problems, and what is going to be, the limit that you're going to, impose to every single condition. Most of the pathologies that we treat in skull base, they are benign tumors, so to say, so which are not cancerous, but they invade and they push very important neurovascular structures, destroy the base of the skull, can cause cranial nerve deficits, impact the brainstem function, and literally kill people, right? So they're not benign in any shape or form, in my opinion, but they're not cancer. And so ideally, we would remove all of those tumors completely and everything would be fine. But there is a price to pay when you do that in every single case. In many tumors, we can do that, and patients do fine and they're controlled just with surgery, and that's fine. But one of the beauties of skull-based surgeries or importance of integrating that with new tools like new radiation treatment modalities like radiosurgery, new treatment modalities, new tools. So, for example, endoscopic skull base revolutionized everything. It started about 20 years ago only. And the number of different tools that we have. So, we have microsurgery transcranial approaches, we have endoscopic and nasal approaches. Now we have endoscopic transorbital approaches that we do as well, gamma knife radiosurgery. being carbon ion that we're going to have here at Mayo in Florida. All of that combined, but all of that is only performed well if you have full application of neurosurgical anatomy of the skull base. So it's still a discipline that is fully based on that concept, independently of what modality you choose. So I think that's a great challenge. The other one is to find yourself your balance in terms of how much to push, how much not to push. That changes over time, and that's very individual for sure. And also this mental exercise about dealing with complications and dealing with situations that to some degree can be caused by your surgical action, not by the tumor itself. So big tumors, big surgery, potentially big complications. So it's also a mental exercise to be prepared to deal with all of that, and you need to be ready. The team approach is one that attracts me as well. It's nice that you work as a team. Actually, so a lot of what we do with another neurosurgical colleague, we do with another ENT surgeon, we do with discussion with radiation oncology, endocrinology, and that's very nice. And finally, I like the idea that we, with the right treatment, with the right selection, we have amazing tools that we can use to kind of like help and treat those patients, uh, considering that the tumor is not a malignant tumor, that sometimes it's a different story, like with the glioblastoma. So, of course, I'm pleased to have the honor to have the chance to treat patients with gliomas and glioblastomas, but it's a very difficult disease. With skull-based tumors, I like the idea that with surgery, we can offer a better, expectation, a better control, a more significant, option.
There's a lot to unpack there. So, first of all, you spoke about a number of tools that you have at your disposal. And you spoke about how endoscopy was a game changer in the realm of scalpel surgery. My question is, what do you think the next big tool is, the next big game changer that may change things completely in the realm of scalpel surgery?
Well, I think the game changers are the same game changers that we're going to have in all the tumors, in all of basically surgery overall. So when we're dealing with oncology, with tumors, our understanding of the disease is still pretty scarce. And if we think about skull-based tumors, maybe even so much more. So, and here I'm talking about the understanding of the differences related with the tumor tissue that we're talking about. So for pituitary tumors, for example, we do have more and more understanding. So even the name pituitary adenomas is nowadays criticized by some that favor pituitary neuroendocrine tumors. Or understanding of the subtypes and the impact of the different subtypes is also changing, and it helps us to better define treatment options. In chordomas, same thing. Like we actually collaborated with Toronto. We participated in a very interesting study looking at the different profile of methylation classifications of those. And then we can identify different subgroups of a disease that we call under one name, but in fact is likely a subset of different type of tumors. The same thing happens with meningiomas and so on and so forth. So I think the first thing will be our understanding of the disease so that we can better predict expectations of long-term disease control, expectations of response to radiation therapy, and in terms of surgery itself, so during the surgery, I think we're going to have every day more assistance. I believe that we're going to have every day more assistance in terms of virtual reality as well, augmented reality. And also at some point, we're going to integrate artificial intelligence in surgical planning as well, such as to say that, for example, a lot of the times when we're doing surgery, we see a structure here, but we don't see the structure behind that. And I believe that with tools that are currently developed, we're going to be able to have assistance. So, say, oh, you're safe. Continue drilling on that specific speed, or you're approaching this structure. It's time to decrease the speed. And it's kind of like I believe that soon we're going to have a virtual assistant in surgery for planning. I believe that those technologies, like 5G and all of that artificial intelligence, it's going to help with remote surgical assistance. So just for example, somebody can be doing a surgery, in Italy, and I can be here and we can have a conversation during that surgery to kind of try to help the intraoperative, management. And I believe that also very impact education for, the widespread society. So I think it is important to think about development in three different aspects: the management of the condition. And I think what's going to be a game changer is really going to be the understanding of pathology per se. the intraoperative management, that's like, intraoperative management in, let's say, high income countries or super developed societies. And that's going to be those tools that we were just talking about: artificial intelligence, augmented reality, virtually assisted surgeries. And then we have to push the field equally so in places that have not as well established historically. Because it is, in my opinion, it's not enough for us to be able to do one single surgery, one man doing one thing in one place, and then the rest of the planet not have access to that. So we need to work on education. We need to work on how we can do better that aspect as well. So I think hopefully so we're going to have work happening to minimize those changes, those differences, I should say, in outcomes across different, I mean, within our own country, but also among different countries.
You touched a number of fascinating. So actually, it's interesting because around a month ago, I had an interview with Upsurgeon and Federico Nicolosi and Paolo Raimondo, and we were speaking about some of these technologies and the way they will impact the entire workforce. And they may actually call for different features in neurosurgeons in the future because they may have to grapple with different problems. And what is interesting to me, you spoke about the kind of personality of Edvando de Oliveira, a pioneer that also used a lot of impulse and creativity and instinct when it comes to surgery. Do you think the implementation of artificial intelligence and artificial reality and some kind of will in some way make surgery a more rational experience and a less instinctual process? And do you think that's a good thing or a bad thing or a mix of both?
Yeah, I mean, call me a nose person or what, but I think surgery is an art as well. So I don't think that this concept should be jeopardized by the introduction of, let's say artificial intelligence tools or, virtual assistants and so on and so forth. Because surgery is, and I think always will be a very intimate experience for the patient, for the surgeon, for the surgical team, right? And that's, that's you trusting someone that really, you don't know that much to open your head or your belly or whatever it is, to go in there and try to fix a problem, knowing that problems can happen. And then for a surgeon, it's the same thing, right? And every surgeon kind of like thinks about this. So I think, first of all, surgery is an art. And the way to master the craft is through surgical anatomy and understanding of surgical techniques. I particularly think that all the tools that we're talking about, they can provide assistance as an assistant, but that can never, and in my opinion, should never be the main thing of surgical care. And I think that's the big problem and the big challenge. In fact, I was a couple of weeks ago in a conference that we had an engineer giving a talk about, automatic vehicles, right? Like the Tesla, BMWs and so. And then he was explaining about 5 levels of automation from 1, 2, 3, 4, and 5. Number 1, you really need that human being to control the machine and provide some support. 2 and 3 is the same thing. And 4 and 5 are the ones that really the machine takes over. And then you basically just sit back and relax. And one of the things that was very interesting is the explanation that the human brain gets along very well with levels 1 and 5. But in between, we have a lot of problems because we don't really pay attention enough when to turn on and when to turn off. So despite the fact that you can have all the protocols in place, if you think that there's going to be somebody taking care of that X, Y, and Z for you, a machine in this case, you may risk jeopardizing the results. So I'm sure that there's going to be a push from the industry and I think safety committees and so on and so forth. But I think the art of surgery and that mastery, that craft will remain the same. And I think that the surgeons that value that aspect, they will always continue to be let's say the well-valued surgeons and will continue to push the field forward.
Well, that's quite comforting to our audience.
Well, I mean, I think that's the case. I do think that there's going to be a push, and the push is going to be maybe part of it based on some statistic level and safety X, Y, or Z, but a lot of it will come actually for economic reasons, and that I can foresee that in my point of view. But the problem is, for example, we have a lot of technology nowadays, right? We have neuro navigation, for example. But if you as a surgeon completely base your surgery in a neuro navigation on a robotic assistance, I am concerned with what can happen. So you can have those tools to assist you during the surgery, but you should know the anatomy. If the neuronavigation is not there, it's not that you should cancel the case. You should be able to do that case as well. But to lose that part of the experience is the part that I'm concerned with. So I think you can lose the neuronavigation, but if you lose the craft of neuroanatomy and neurosurgical techniques, then I don't know how much you're gonna be able to push.
I see your point, and the question is regards what you were saying before about how we're very comfortable with either zero automation or complete automation, and not very comfortable with all the levels in between. That I presume though will be the future of neurosurgery. It will be something in between, full control by a machine and full control by a human. So do you think we should, during training, actually begin using these tools and teach people how to correctly assess the relationship between machines and automation and their precise work?
I believe that any new technology should be experience retraining as well. I think the sooner you learn about it and the sooner you start to evaluate those, the better, because you get more engaged and you can, manage that in a better fashion. So I'm favorable to that at all, for sure. But as I said, I think the word is evaluation. I don't think that all technologies are for everyone. I think everybody needs to understand their own style and their own benefits. And honestly, like if that works very well in a specific philosophy for someone or for a group of patients or for an institution, I think you should go for it. And if it's beneficial to you and to your patient, go for it. But as I said, I believe in surgery as an art. And I think as an art, everybody has a school and a philosophy. And the philosophy that I believe and the one that I incorporate is one that truly believes that you must master the basics, which in our case, or especially is surgical anatomy, the applications of surgical technique, and then everything is built upon that rock, not the other way around.
So it's a question of hierarchy of values. Yeah. And I understand.
My concern is you may skip that block that is very important because you can say, well, but we have all this technology. I don't need to know any of that. And then you're going to base your growth on a very...
pillars of sound in a way. Yes. Interesting. I think that segues quite well into my next question. And then we'll go back to something else you said that I also think is quite interesting. So let's talk about the inception of the Skull-based lab at Mayo and what its primary objectives are. How does it contribute to neurosurgery training? And especially, how does it contribute to neurosurgery training in the context of an ever-changing neurosurgical landscape as the one we're talking about?
No, thanks for bringing it up. The Skull-based lab, it's, of course, one of the, I have to say, greatest things that we have here at our campus now. I'm very, very proud of this project and very proud to be part of this project. It is an initiative that started with, in fact, when I moved here exactly 2 years ago now to Mayo Jacksonville, I was interested in developing a Skull-based lab. And then I was introduced to the project of a temporal bone lab for 4 colleagues in ENT were working on. And what happened then was that through Dr. Q and Dr. Janice, we organized those pieces together and we moved even beyond what a temporal bone would be. So we have now a skull-based lab where we have a temporal bone lab component, we have an endoscopic skull-based component, we have a microneurosurgery component, we have the ability to practice microanastomosis, head and neck surgery, and lateral skull-based. So we can do a lot. And that's really the result of the union, the joint forces of the departments of neurosurgery and ENT here at Mayo Clinic in Florida. And I'm always very thankful by the leadership of Dr. Jeffrey Janis, ENT, and Dr. Alfredo Quinones in neurosurgery. And then, of course, the opportunity to move this lab forward. The lab itself is hosted here in the SWO building north of the in the simulation center that we have. And it's a beautiful space, right? We have 12 stations, 11 for the trainees, 1 master station. Right now, we are hosting the planet, I say. So we have 4 fellows right now at this moment. 1 from Brazil, just arrived today. 1 from Argentina, 1 from Italy, and 1 from Spain. So as you see, like a lot of people. I shouldn't say the planet. The planet is really going to be when we have somebody from Asia, Africa, Australia, which is definitely within the goal. That's definitely the next step. But so the first and most special thing we have is the people. Without those people there, without those fellows, it doesn't matter. Whatever nice technology we have, that's this. So I'm very thankful to have those 4 guys there. Lord from Argentina, Juan Pablo from, he's from Colombia, but training in Spain, David Russo from Italy, and Vinicius Ribelli from Brazil. So first of all, very thankful for that. And then with talent, we have now the structure. So we can attract those guys here. We have microscopes, endoscopes, high-speed drills, hand holders, everything that you can think of. In fact, today, we're opening up a virtual reality machine that is going to be housed in the Scalpel lab in partnership with one of the industries. That is the next step when we're going to push it forward. So within this space, the number one goal is education, right? So it's really to push people that is interested in pursuing mastering surgery forward. So we're going to be educating people, providing the instruments for education, providing feedback in surgical anatomy, photography, and surgical techniques. And we're, for example, developing with each one of those people that I just mentioned a specific project. Additional to education, the step 2 is research. So we are working now specifically on surgical anatomy and surgical techniques as a part of research. We're going to move forward as a third step as the integration of visualization and development of AI-based softwares for evaluation of surgical ability. So with the tools we have now, we can basically check the movement of instruments. So we can check the number of movements that you perform during a surgery to achieve a goal. And what I foresee in the future is if with the right input, those softwares can provide you good feedback to really evaluate how you did in your surgery. And then you can have an objective metric to assess what you're doing.
Oh, that's a
And I
game
think that
changer.
would be interesting.
Yeah, that's a game changer because it's not just about watching surgery and saying, do it like me, but it's do it precisely like this with these metrics. Do X, Y, and Z. That's incredible.
What I find more interesting is the ability that ideally, I have to tell you, as I said, I'm very old fashioned. What is ideal is that everyone and every single one would have the ability to have a mentor next to you and to practice deliberate guidance learning. So not only working hard, but working hard with guidance. And I honestly think that this personal interaction will never be replaced by anything. I think that's essential. But we have to face the reality. Not everybody will have the ability to be here. Not everybody will have the ability to have a mentor directly face-to-face have that. So considering that plan A is not available to everyone, I think the closest to that is if we can train, an algorithm, we train machine, provide feedback on specific points. Because also, I don't believe that a feedback saying great surgery or terrible surgery is good enough for anything. I believe that you should provide objective feedback. What is, this surgery went very well. I like how you expose the bone. I like the maneuverability. I like how you provide this specific movement. I like how you were gentle with the instruments. I like the selection of instruments. I like how you control bleeding in specific moments of the surgery. And I think you were effective in your surgical maneuver. Feedback that may be called negative, but constructive in nature would be not, oh, that was an ugly surgery. No. It should be, that was not a beautiful surgery because you didn't select the instruments well. You were not using the instruments properly. This bleeding, you took, too long to control and you could do it more effectively if you've done this, this, and this. So I think that's the type of feedback that we don't have even right now. So I think that's the type of thing that is necessary for you to grow forward. And that's what we're interested on.
So when it comes to, for example, I remember we had a conversation about the limitations of anatomy and just working on cadavers. And the question is, how does the lab simulate real life surgical conditions for training neurosurgeons? And do you think that the recent advancements in artificial intelligence will be able to also help with achieving a situation that is more similar to reality, even when touching cadavers and working on cadavers?
So I think, I have to say, I don't even think cadavers, so biological tissue, is still is the best tissue for learning and understanding of surgical anatomy, surgical approaches, and anatomy. Once that's said, so I think that's the paramount piece of it. So if you can have that, just having a mentor side to side with you, I think you must try to the best of our abilities to have that experience as well. However, as anything in life, the cadaver based experience also has cons, as it has many pros. It also has limitations. One of the limitations is when you're dealing with tumor resection or clipping of aneurysms or even placement of catheters, ventricular surgery. All of that is more complicated in cadavers. So you can even develop cadaver models for that, but the replication is more different. It's more difficult. Every single biological tissue is different from the next one. So it's difficult to assess or replicate a specific step of a procedure on that. And therefore, I believe that, for example, the technology on simulators has an advantage and has a positive on that. So I'm a believer that simulation, in terms of simulating surgical procedures per se, can be extremely beneficial, specifically even superior to the cadaver experience in specific points. So I believe that the anatomy and the surgical techniques and approaches itself should be done through cadaver experience, and then specific maneuvers in terms of surgical procedures like meningioma removal. You can have a model with a meningioma, remove that meningioma, and you can record all of that and you can assess all of that. So I think that's the step. It's not one versus the other. I don't believe on that. I don't think that's the way to go, but it's adding one piece to each other and then extracting the best you can from each one of those. That's how I see it. And the advantage with the simulation model learning is that since you can replicate, you can also evaluate how different surgeons perform on the same task. And that can provide an objective metric for learning experience and for learning ability.
But I was thinking that maybe on the opposite, as a con, cadavers are, I imagine, slightly different between each other, so they better reflect the natural variations among human anatomy. That maybe with a simulator that has one specific brain, you will not be able to replicate precisely. So people may end up expecting something that may just not be there in that specific patient.
Yeah, but then we're talking about what simulation is right now. In the stage where we are, we can do 3D printed. We do 3D printed models here for a number of cases, by the way. But the quality is improved a lot. The quality is not there yet, but that's going to get there. I have no doubt whatsoever. So what I believe is that the stage where we are right now, we can have, 100 simulators of the same model, let's say removal of meningioma, that are exactly the same. And as you said, the limitation is that you don't have anatomical variations on there. But we are certainly so moving forward with development of 3D printed simulators that are patient specific and that will provide us with the ability to actually do that surgery before doing that surgery, and then providing us with a better, certainly so experience for the actual procedure. We can already do that in a virtual reality setting, but I believe that with the physical model that you can touch, operate on the same precision, and do everything the same in a lab, like our lab, you can provide even better outcomes to your patients.
That is absolutely amazing.
Yeah, I agree.
So I had a question about meditation and spirituality, because it's clear that aside from how the landscape of neurosurgery is changing, the way you approach neurosurgery is one of great spirituality and with a feeling of beauty and art and meditation. And I was wondering how much of that actually ends up showing in the operating room when you're in the OR. How much of the surgery is rationalization and thought process and thinking, and how much is just instinct and going through actions that perhaps you've performed thousands of times and that you've perfected across many years to just become natural to you?
I believe that when you perform that action for many years, certainly so it becomes natural to you. That's the concept of it. So the more you do, the better you do. So that's the concept of focus. And I believe each one of us should have focus in one thing that we're passionate about and that we strive to master. So I'm a skull-based surgeon. I do open and endoscopic cranial surgery. I do a lot of academically endoscopic is what a lot of people know me for, but I don't do spine surgery, for example. So I certainly cannot be as good in spine as I can deliver in skull base. So that's the first thing. The other aspect of it, I think, once again, as I told you, surgery to me is art as well, additional to being science. And then that's a very intimate relationship between you and the patient in the OR. Once that's said, that's the moment that you need to me at least, to change gears and to benefit myself, in my case, of obsessive compulsive disorder. So surgery, and that's the words of Dr. Evandro again, it's like a cookbook. You need to have a specific plan for each given situation based on the anatomy of each one of your patients, on the preoperative symptoms and the expectation, and your surgical expertise and surgical anatomy knowledge. Then you define all those goals before surgery. And an ideal surgical day is the day where everything you had planned before just happened as you had planned. So, yes, there is an instinctive nuance that you learn as you go through that experience, but the planning is there. So, I plan to expose as much as possible, exposure 70% of the surgery, identify the tumor, mobilize the arachnoid, debulk the attachment, the tumor, detach the vascularize and remove the attachment, mobilize the vessels, the nerves, the arachnoids, and remove the tumor. Then close everything. That's kind of like 90% what we do is skull-based surgery. So if you follow that basically regulation, that protocol, you're going to do pretty well. Once that's said, every patient is a bit different, and you may change the plan as you go. But the nicest thing about surgery is that at some point it becomes, you can see things that you couldn't see before. You can get better in a way that you couldn't feel before. And the growth, in my opinion, in surgical ability and surgical expertise, it's kind of like everybody has the impression that it's a linear. No, it's like something that goes in out of nowhere. Someday, boom, you just you just kind of like explodes, and then it's like this, and then this, and then and it's difficult to me to explain, but you can tell those when those stages happen in your life. And but I think the OCD rule helps a lot in the war.
That's really interesting. Something else I was thinking, as you talked about focus, I imagine that there are some parameters that may be able to identify when a person is in focus outside of just them saying that they're in focus and they're able to perform at the highest of their abilities. Like, for example, instead of just, as you said, monitoring the pressure of the instrument upon the tissue, you could also measure heart rate and blood pressure and maybe specific vital signs that may indicate that a person is able to comfortably be inside the operating room and execute a plan in focus and in a state of almost pseudo meditation, as you were describing it before. And I was wondering if that could be something that you incorporate in the parameters.
Yeah, I mean, you can definitely measure all of that. Like that's, as I was telling, I have a brother. That's exactly his line of work, is to check in all those physiological monitoring devices that you can do to check exactly all of that. And I think that can be done. But if you think about surgery as also an art or a sport, so to say, like you're an athlete and being a surgeon, you have to think who checks all of that. It's not necessarily the athlete, so to say. I mean, you don't check that as you do the surgery yourself, but certainly, yeah, you can have somebody checking that. I mean, you can check that outside as a feedback to your experience after the surgery. And by the way, very important to mention, since we're talking about the surgical experience, is one thing that is very important. Just like in sports, as you check the video of the game, so to say, afterwards, as a surgeon, if you want to grow and you want to become better, there is nothing better than you yourself as a surgeon to go back, check your
For
video,
Gale. Yeah.
and understand how you did. So I think then yes, maybe those factors can be incorporated in this post-surgery, post-game review, so you can understand where you went to. But I don't think that the human brain adapts well to a lot of noise around. So I'm concerned with too much noise, so to say, at the time of the surgery. I think surgery is many things, including meditation. So you need to be very peaceful in that experience as it happens. That's my personal take.
Hmm.
Oh, that's quite interesting. Let's go back to education because that's of course what you're aiming to do with the skull-based lab. And you spoke about how education and training in the realm of neurosurgery is not just a straight line going up. It's a lot of plateaus, and then you hit a plateau, and then all of a sudden you grow immensely, and then you hit a plateau again. And my question is, what were your ups and downs? Where did you hit your plateaus, and how did you get out of those?
I don't even know like if one can define exactly the moment. Like I mean, I can tell you like that. The moments that I excited to move and to do things differently, right? So, for example, let's say Brazil, despite being trained with Dr. Oliveira and being exposed to so many amazing surgical anatomy and surgical techniques, the group that I worked with was focused a lot in cerebral vascular surgery, which I love, but I realized that I wanted to focus on skull-based surgery. And then to do endoscopic skull-based surgery, which I think is paramount in the realm of skull-based surgery nowadays, required me to learn more. So I was doing pituitary surgery, endoscopic pituitary surgery in Brazil, but I wanted to do more than that. And I realized that, this is taking too long. This is not going smoothly. I would see videos of other surgeons doing, much better work than I was doing at that time. And I wanted to get to that level. And that's when I realized, okay, I need to be exposed to other people. I need to be there with them and understand what is the challenge and how they set up things and how they do better. And that's where, Toronto and Dr. Gentili and Dr. Zad and all of that can help me a lot. Like it really opened the door. And then I went to Cleveland. And then in Cleveland, at the Cleveland Clinic with, Pablo and Varun and the entire team, like then we were as young people, like we were doing even more. Like we were doing like some work, in terms of endoscopic scope base that I think were quite advanced. And then after that experience, then I had to prove to myself that I could do it, right? I mean that I could do it without that I could be that person leading that, and then that's where the experience at Mayo Clinic has really been formidable to me to be able to really push a few things. So now one we are like one of the high volume centers in the country doing techniques that are quite advanced, like medial wall resection of the cavernous sinus surgery, a lot of advanced endoscopic skull based surgery, additional to the classic transcranial microsurgery that we do. But all of that was a learn. Like it's kind of like I remember the first patient. It's kind of like, okay, we're gonna do this, and then you do that, and you say, oh, I did it. It was awesome, but I can do even better. I need to get this instrument, this instrument, this instrument. And then you need to get the team on board to kind of understand the philosophy. And then there is always some feedback, right? And then you have to go through that stage, get everybody, show the results, confirm the results, publish your results, and then that's how you move forward. So I don't think that answers the question. I don't know if I can explain a moment per se, but I can sense the stages.
Beautiful. Having worked in different parts of the world, such as Canada, you've worked in, of course, in Brazil, you've worked in the United States. What are the main differences that you've observed in your surgical practices and patient care? And how have these diverse experiences shaped your specific approach to neurosurgery?
Yeah, I think the first and most important thing is the concept and the understanding, which is simple, but sometimes we may forget. But different require different. Like so, especially when I was in Toronto, which is a multicultural city, really multicultural city, we would have, I remember well, we had a pituitary clinic on Wednesday afternoons, and we would have Italian family and Italian patient. That's a style. And then you have a Brazilian family. It's a different style, but still the same. We're emotional people. We're hot
Yes,
blooded
but
people. And then you have a Chinese family. That's a more objective personality, like a German family would be, maybe to some degree, more objective as well. And once again, it's not right or wrong. It's just different style. So the cultural style of patients, big difference. We need to understand that we need to treat people differently as people, everybody's different really. So that helped me a lot. I mean, so I try not to project too much into patients what I would like because I know people is different. So that's it. The second point is your colleagues. Every one of those places have a different health system. And then there is a different expectation about what medicine is and what, surgery is. So in Brazil, we have basically a system where you have a universal public health system and you have the private system there as well. So you have a bit of both worlds. In Canada, we just had the universal health system in your surgery. And in the United States, as we know, it's mostly so private healthcare system. So each one of those, there is a different nuance. In Brazil, we have both words side to side. In Canada, you had a word like that was universally carried off, and then they're very proud, I think correctly so, of the healthcare system they have there. And then in the United States, there is the most advanced medicine in the planet, but of course with the challenges that come with private care and coverage and insurance. Of course, I mean, if everybody in this planet could receive the care that we can deliver here, I think that would be excellent because the technology really helps, but there are challenges associated with that. So to me, I think there was the challenge of understanding the cultural differences of patients, adapting to the cultural differences of the different systems, and then moving into that, and then of course adapting to it. I don't think the system will need to adapt to me. I needed to adapt to the system. I think that's very clear, and I'm pleased because I try to see the benefits and the good sides of all the places that I go to. And as a surgeon, I think that once again, because the basics is the same, maybe you can have, I don't know, different microscopes, different instruments, but since the basics is the same, the basics are the same, the surgery experience shouldn't change much, you know? So I believe on that tremendously so. And I have worked in very simple hospitals, believe me. And I work nowadays at the Mayo Clinic, which is the number one hospital on the planet. And the basics, they're always the same. So without that concept, you cannot do anything. If you skip that step, they can give you, you know, if you don't know how to drive, it's not giving you a Ferrari that will teach you how to drive.
Agreed. So we're getting towards the end of the interview, but since of course this is what the Mission Brain podcast focuses on basically resource and training disparities and how they impact neurosurgical outcomes in different regions. How do you think you can make the skull-based lab at Mayo as inclusive as possible? I mean, as you mentioned, many people will be able to visit and are visiting, and you plan to have the world there, as you said, which I think is a great way of putting it. But there will be many people that will never be allowed to be there in person. How will we be able to make this as inclusive as possible for those people and allow for as many people as possible to benefit from the enormous benefits of an initiative as the Scalpel at Mayo
Yeah.
Clinic?
So I believe in a true front here. Definitely everything that you said is a goal, right? I mean, I would love one day to have like five people, one from, you know, I don't know, one from North America, one from South America, or I should say Latin America, one from Europe, one from Africa, one from Asia, one from Australia, Oceania, and etc. So
One
really
from
the goal,
Antarctica.
maybe, who knows? What is the, you know what I mean? So it's kind of really to have the globe rather than, you know, a specific geographic zone. I think that's a benefit to everybody. I mean, certainly so for us. But as you mentioned, there's a lot of people interested that would have, it's very expensive to come here. And then they would have a difficulty to come. I mean, nobody has to pay anything to be with us in the lab, for sure. But at the same time, they have to move away from their home, find a place here, travel here, of course, eat and drink and sleep. That's a human basic necessity. And that's very difficult. Let's face it. It's very, very difficult for many, most people. So one of the things that I would love to be able to do, and now you're working more and more, is to develop solutions through maybe donors, institutions, funds, grants, foundations to facilitate the welcoming of surgeons from low and middle income countries, especially to come here and be trained with the goals that we discussed today. And the other front would be as well to be able to host more, you know, online based activities or social or virtual reality based activities where we can try to share some of this information. I'm hopeful that with the development of the technology that we were discussing later today, that we can engage more activity in terms of online based activity, either that's through surgery or through mentoring. But I'm hopeful that that second step can also be helpful to many around the planet. But as a immediate next step, I would love to be able to partner with foundations to, you know, host, I don't know, maybe four people along the year that would come from places that otherwise they would not have the ability to be here. Many examples in Latin America for sure, examples from Africa, from Asia, and of course, why not like from Europe as well? I mean, we have challenges everywhere, so that's something that I'm very much interested in exploring.
If somebody in our audience were to want to participate, how would they reach out to you and how would they reach out to your team? What would the ideal way be?
Yeah, I mean, right now, like I just tell people to send me an email. So my email is a simple one. You can share it's almeida.joão@mayo.edu. And then basically with that information, tell people to send an introduction email with who you are, what stage of training you are, what would be your goal and your CV, of course, if possible, a letter of recommendation. And then we can try to set up a conversation and see the possibilities. Of course, there is a lot of interest, and there's a lot of people interested in coming. We do the best we can to host everybody. There is always a waiting line, so But please, if you're interested, connect with us, and I would be pleased to try to make it happen. And I'm hopeful that in the future we can make things even easier. And then, of course, I'm just one of the team members. We have, if you are an ENT surgeon and you wanted to come through a ENT route to come here, I'm more than happy to facilitate and try to expose to that learning experience. And if you have any different interests, let's say spine surgery, which is not something that we know directly in the skull-based lab, but we have great spine surgeons here. I'm definitely happy to introduce you to that as well.
And do you have any final thoughts or messages you'd like to share with our audience before we
Yeah.
say
I
goodbye?
think that at least I suspect that we have a lot of young people in the audience, right? And I think that me myself, I consider that I still am kind of like young. I'm about to not be young anymore, but one thing that on my personality has always been is a lot of anxiety to kind of grow. And I would just say focus on the basics, understand the basic, master the basics, and build everything else on top of that as time goes. Be mindful because challenges will come. Life is completely unpredictable. You're going to create a plan and you're going to think that things will happen like in 5, 10, or 15 years. I'm pretty sure that those plans will change and life will happen and things change. But be mindful that you can overcome challenges with the right peace of mind. And I think the most important one is, this comes from Dr. Oliveira is, try to find your passion and commit to your passion, really work towards it. And I think somehow, some way, at some point, you're gonna find, the happiness that you're searching for through that passion of yours. And then, of course, the final thoughts. I mentioned, the names of Dr. Oliveira and Dr. Gentili many times here, but I have to be very, very thankful of Dr. Quinones, who is also one of my mentors, a great surgeon, great source of inspiration, somebody that, you know, helped to found Mission Brain as a project and as a foundation together with Dr. Martin, and that really inspire certainly saw this community here. Uh, a power of nature for sure. The energy of Dr. Q is nobody can beat that man on that aspect, and I'm very thankful because I think additional to all of this that we did, that we talked about, the other thing is to inspire people to kind of go and do better, right? And I think that if you guys came up with the Mission Brain podcast, it's because you were inspired by that concept as well. And the Mission Brain and all the chapters around the globe, I think they were inspired by the work of Dr. Quinones, and I'm certainly a big fan. And as I said, I'm very, very pleased not only to work under his leadership here at the Mayo Clinic. He is my chairman, the dean of research here, but also he is a personal mentor that has helped me a lot. So that's a final remark. Just a big thank you to you, Luca, to Alicia, to Luigi, and of course to Dr. Q and the entire Mission Brain project, which I'm a big fan of.
JP, thank you so much for being on the show, and I hope I'll be able to see you again soon.
It's always a pleasure. I hope to see you soon in Napoli.
Yeah, that was incredible. Yeah, the guitar right there.
Yeah, unforgettable experience.
Yeah. Next time with some bossa nova.